Megadosing creatine after 30. Does taking 10 to 30 grams a day boost muscle, brain, energy, and focus, or is it risky? In this Doctor Explainer, we unpack creatine monohydrate benefits, dosage, side effects, cognitive performance under sleep deprivation, kidney safety, and what actually works in the real world. If you want the honest answer on high-dose creatine, keep reading. This is the guide I wish every patient saw before experimenting. I've also linked third-party tested creatine and recovery basics in the description, optional, evidence-based, and what I trust. What megadosing really means. Most people know the classic approach, a short loading phase of about 20 grams per day for 5 to 7 days split into smaller servings, then a maintenance dose of 3 to 5 grams daily. Megadosing is different. It means running high intakes, 10, 15, 20, even 30 grams per day, not for a week, but for weeks or months. Online, it's often promoted less for muscle and more for mental clarity, brain fog, and fatigue resistance. Definitions matter, because the evidence base for standard dosing is huge, while the data for chronic high doses are early, mixed, and mostly short-term. Why people are trying it now? Creatine is an energy buffer. Your body stores it as phosphocreatine in muscle and brain to rapidly recycle ADP, the currency of cellular energy, when demand spikes. The idea behind higher doses is simple. Once your muscles are saturated, surplus creatine might be more available to the brain, where uptake is slower but real. People report sharper working memory, better reaction time under stress, and fewer dips during nights of poor sleep. Vegetarians and vegans, who tend to have lower baseline creatine stores, sometimes notice the biggest cognitive bump. Add the modern cocktail of shift work, long hours, and screen fatigue, and you can see why high-dose experiments are trending. What the research actually shows. For muscle and strength, the verdict is straightforward. Once your muscles are saturated, taking more creatine doesn't grow more muscle. The gains come from consistent training with a saturated system, which a simple 3 to 5 grams per day achieves over time. For cognition and fatigue, the picture is more nuanced. Several small studies show that higher intakes, such as a week at 20 grams per day, or a single acute dose scaled to body weight, can improve working memory, reaction time, and mood during sleep deprivation or high cognitive load, with the clearest benefits in people with lower baseline creatine. Other studies show modest or no effect. Importantly, most of these trials are short. We don't yet have robust long-term data on taking 20 to 30 grams daily for months or years. The risks and downsides you don't hear about. Creatine remains one of the safest supplements for healthy adults at standard doses, but dose makes the difference. At higher intakes, the most common issues are gastrointestinal, bloating, cramping, loose stools, especially if you slam large single doses or use gritty powders. You'll also see a normal increase in intracellular water inside muscle, which can nudge the scale up a couple of pounds. That's not fat. The more serious trap is in the lab work. Supplemental creatine breaks down into creatinine, a marker doctors use to estimate kidney function. High intake can raise creatinine enough to look like kidney stress even when kidneys are fine. If you land in the ER with an illness and no one knows you're supplementing, that false alarm can trigger unnecessary admissions and costly workups. Some clinics can run an alternative marker called cystatin C to clarify true kidney function, but it isn't available everywhere. If you experiment with higher doses, disclosure to your clinician isn't optional, it's protective. Who should be cautious or skip it? If you have diagnosed kidney disease, uncontrolled hypertension or diabetes, a history of recurrent kidney stones, or you're on medications that stress the kidneys, this is not a DIY experiment. If you're acutely ill, vomiting, diarrhea, fever, pause creatine until you're hydrating and eating normally again. Pregnancy and breastfeeding don't have robust safety data for high-dose protocols. And if you're managing complex psychiatric or neurologic conditions, talk with your treating clinician before changing anything. If you're going to experiment, do it like a pro. This is not medical advice. It's practical risk reduction. If you and your clinician decide a short trial is reasonable, keep it time-boxed and modest. Choose creatine monohydrate. Use split servings across the day with meals, and start nearer the low end, 10 to 15 grams per day, for 1 to 2 weeks while you monitor digestion, sleep, and cognition. Hydrate normally. Track your training performance and a simple cognitive task at a consistent time, and document how you feel during sleep-restricted days versus well-rested ones. If you notice no benefit or you develop GI issues, back down or stop. If you continue, return to a maintenance 3 to 5 grams per day. That's where the strongest longevity and muscle preservation data live. What I recommend as an ER doctor. For the vast majority of people over 30 who care about strength, muscle, and healthy aging, the smart move is simple. Creatine monohydrate at 3 to 5 grams daily, combined with progressive resistance training, adequate protein, good sleep, and regular movement. That protocol is boring, safe, inexpensive, and relentlessly effective. Megadosing may have niche, short-term cognitive applications, particularly under sleep deprivation or in individuals with low baseline creatine, but it remains experimental. If you're tempted, do it with eyes open, for a defined period, and in collaboration with your clinician. What you can expect on a realistic timeline. With standard dosing, many people notice a slight uptick in training pop within 2 weeks and better repeat set performance by weeks 3 to 6. An extra rep here, less drop-off there, smoother recovery between efforts. Over 2 to 3 months, the benefits show up in daily life. Stairs feel easier, yard work less punishing, balance steadier. On the scale, expect 1 to 2 pounds of water and muscle early on, which stabilizes. If you're dieting, creatine helps preserve lean mass when you lift and hit your protein, which is exactly what you want. Myth busting in one breath. Creatine isn't a steroid, doesn't fry healthy kidneys at standard doses, doesn't inherently dehydrate you, and benefits women as well as men. The hair loss fear is based on thin, inconsistent data. The biggest real-world problems I see are dehydration during illness, GI upset from poor dosing habits, and confusion over lab interpretation when clinicians aren't told you supplement. The bottom line, megadosing creatine after 30 is intriguing but not essential. For muscle and longevity, the heavy evidence still supports 3 to 5 grams per day of creatine monohydrate plus smart training and nutrition. For cognition under stress, higher short-term doses may help some people, but the data are early and the long-term risk-benefit is unknown. If you choose to test it, keep it short, keep it split, stay hydrated, and loop in your clinician. If you've tried higher doses, I want to hear your experience, dose, duration, what you actually noticed, and whether you'd do it again. If you want my simple, doctor-approved 12-week strength plan to pair with creatine, comment Megasmart, and I'll share it. Share with the night shift warrior in your life, and subscribe for the follow-up. Creatine for cognition. What we know versus what's hype.